so marvelous to be with you all today, and I wanted to just comment on Pastor Renner's marvelous statement about service. Incident, I cry very easily, so if I start crying, it's joyful. And I just thought Charles was an exemplar, as you said, and that the pushing to the point of fatigue and through fatigue is sort of what we grew up with. And I happen to be a physician, but it's the same as in nursing and in the PA world and the like. And then I loved your comments, and I never knew he was Buzzy otherwise. I sure would have called him Buzzy, or found maybe a word, way to make it even weirder. The way we got together, first of all, I need to just say a couple things about myself, because we know that Charles was a physician assistant, and I might start with him. He was in the Emory class of 73, which was the first class, 24 months, so he started in 71. And he took the first national board exam for PAs in December of 73. I was very involved. I'd started the program at Yale in 70 and had been at the NIH working on PA matters starting in 68 with this very handsome guy who's my identical twin brother named Blair. So we had learned about physician assistants, and also that's when we learned about transplantation. But Charles got an early start, and then as you see in his bio, that I hope you'll read in detail and maybe read several times, because he accomplished so much, that he worked for surgeons, and then he worked in the medical examiner's office, and he got a chance to start the Atlanta Organ Bank. And what was amazing about his skills that follow up on what Pastor Renner was saying in terms of what kind of service was, he was very good clinically. He loved the surgical dimension, and so when dealing with the organ removal, the kidney removal from the organ donor, there's a whole different process that you can do when someone's dead. You just make the incision anteriorly, you can just open the person up, and it's much easier to remove the kidney. So for years here in Atlanta at your organ bank, he was the person that was actually removing the kidneys from the donors. Not that there weren't some others too, but he was one of the principal ones. So he was that skilled and that trusted as a clinician. He then got involved increasingly in the OPO, the Organ Procurement Organization system, which was established in 1984, and 55 of those were set up. He was very involved in the one here in Chattanooga, and then now up in North Carolina. So he was also involved in the system of care and the way it needed to be improved. And now going back to me, how did I get involved in this? I was at the NIH in the Public Health Service with my twin brother Blair, who's a lawyer, as I said, and we were a medical legal team, and we were allowed to work in the director's office of the NIH in 1968, just at the time when the Vietnam War was exploding. And so a chance to avoid the missiles and do something creative. It was also a very creative period, the 60s. So it was a very can-do attitude. So we were just thrilled. The first thing they got us involved with was all about organ transplantation. So we helped write the model law in 1968 called the Uniform Anatomical Gift Act. It passed every state in 3 years. And it's the law that we all live under that allows us to donate our organs if we don't make a statement, the next of kin, and other important issues. And then they ask us to look at the workforce problem, which was created when Medicare and Medicaid were adopted and put into law in 1966. All of a sudden there were a lot of old people like me now, I'm 84 now, who had authorization for health care. and there were also Medicaid for people below the poverty line. So who else could give care? And that's where these outstanding physician educators like Dr. Stead and at Duke, who started the first PA program in 1965, said, let's take military corpsmen. They've had all this marvelous training. They would come back to the United States, and you could be an orderly at my hospital if you wanted to, but that's all we have available for you. So he said, let's give them a little more training and build on that and show you how powerful that was. At the height of the Vietnam War, there were 6,000 military corpsmen being discharged each year. Is that a manpower supply or what? And then there were people in other health professions, nurses, who wanted to do more. Colorado started the Family Nurse Practitioner Program. So Blair and I were asked to, by the Assistant Secretary of Health, to look at how you credentialed these people. And basically it was a simple amendment to the Medical Practice Act rather than a whole new law. So that's my background, and in 3 years I was fortunate to be involved in two very exciting issues, and then got a chance to go to Yale, work on emergency medicine, start a PA program, and then do the Robert Wood Johnson Foundation. So for 9 years, I didn't see a patient. I just had an internship, and then went back and was very interested in primary care at that point. And then eventually moved out to California, where I've discovered Monterey and Carmel and said, I want to practice here. So I've been there ever since, and continue to work with PA programs at Stanford and the nurse practitioner program at San Jose State. Met Charles really for the first time about 15 years ago, when someone you're going to hear about a little later, Greg Siegel, his father was dying of heart disease that they couldn't cure except with a transplant. And he just about missed the boat. About 5 years, he got a transplant. He was in New York City, and he's still alive today. And this was 20 years ago. So Greg, who was very involved in finance, said, I want to do something to make this organ transplant system work better. A lot of you who are involved in that, are living that. And so he set up something called Organize, which is kind of a cute name, and wanted people on his board. Heard about Blair and me, got us on the board, heard about Charles, and we had a meeting, and the next thing you know, we became fast friends. And over the last 15 years, he and I have just spent a lot of time, even though we're on opposite coasts, on the phone, FaceTiming, and discussing the issues of the day. Another real tribute to his tremendous contribution on the whole scene of organ donation and transplantation is something called the NASM report, National Academy of Sciences and Education and Medicine, that he was the principal PA and organ coordinator on, along with all these academics and people from the OPOs, where frankly the whole situation had gotten quite political. So there was a lot to deal with, and he dealt with it. He was very tough. He was sweet and kind, as you all know, but he was also very tough. And we would talk about this and how we can help get, there are good performing OPOs and there were poor performing OPOs. How can you get them improved? In the course of this, we just became great friends about life in general and what was going on. My wife is a nurse practitioner, now an artist, and those cards you see, please take one, are her business cards. And what she's doing, is coming out this week, is she's doing a book called Otter Therapy. And it is taking classic portraits, like with the Scream, or the Girl with the Pearl, or if not portraits, photographs of celebrities like Clint Eastwood, and putting an otter face on them. And it's just so charming and delightful. You can't help but smile and laugh. And I will see that you get copies of that. But she's Japanese. We met about 30 years ago and had both been married before, and then got our practice marriages out of the way. And her living happily ever after. So she has stopped being a nurse practitioner after 30 years and is now doing art full time. So if any of you, some of you I think are coming out to Carmel in the next couple of weeks, but if any of you can come visit, please do. Let me just tell you another moment about the last year with Charles. It was when he developed this palsy that made was ascending from his feet up to his neck and throat. It made him so weak, made him lose weight, made him not want to eat. It was so tragic because there's no real treatment for it. So you do all these palliative things, and feed tubings and liquid, things, and yeah, he didn't like any of those things, So, and then he got another disease, and then he ended up getting cancer, and so he just, but he fought it all the way, and he kept working as a transplant coordinator. He was the oldest living transplant coordinator in the country, almost 50 years, which is just extraordinary. And in the end, he was no longer working at hospitals or when he was sick, but he was still on the phone coordinating, still working at nights, and I kept kicking Buzzy's butt and said, Buzzy, no, I actually didn't say Buzzy, but I wish I had. You just got to work days now, and I think Dana would clearly agree with that. And so he finally did, and reduced his time, and then eventually just couldn't work anymore because there was no cure for his lung cancer whatsoever. So it was just, but he was always interested in how I was doing and what was going on in my life and other people's lives and my twin brother's life and what was going on with Organize. And so he just cared about so many other people. And I think I'll stop with that and say it was a privilege to know him.
Thank you, Fred.
And then our next person is Todd, I believe.
My son.